Hi, thank you for attending our Surrogacy One-on-One Step-by-Step Guide through Surrogacy. My name is Suzanne. I'm the third-party manager here at SCRC, and we have our guest, Lesa Slaughter.
Hi, I'm Lesa Slaughter, an attorney and former intended parent through surrogacy.
Next slide. Dr. Surrey, who is actually our medical director. He is a co-founder of Southern California Reproductive Center. He also actually serves as a clinical professor in Department of Obstetrics and Gynecology at the David Geffen School of Medicine. He is one of the best doctors here at SCRC, along with the other doctors that we have here. Next slide. Me, I'm Suzanne. I'm actually the third-party manager. I oversee our third-party team. We match our intended parents and guide them through the surrogacy journey, egg donor journey, intended parents going through egg donors, sperms, and gestational surrogacy. I actually been in the industry for a little bit over 14 years, started my career off as an administrative assistant, moved my way up, matching intended parents with surrogates and egg donors, and then a recruiter for surrogacy and egg donors. And now I'm actually helping couples with their parenthood and their journeys. Next slide.
Hi, I'm Lesa Slaughter, an attorney practicing in this particular space, which is called third-party reproduction, which means surrogacy, egg donation, and embryo donation, and the occasional known sperm donor process or contracting. I'm actually an intended parent through gestational surrogacy myself, and now have 16-year-old twins. So be careful what you wish for. And it's been a great process. We had an interesting road through the surrogacy process. Overall, it was very successful, and we were very happy with it. And I'll go through some of the legal and practical steps of something to think about as an intended parent starting this journey from the moment you walk out of your IVF doctor's office. Next slide.
So SCRC, we also have a proven track record of more than 25 years of experience. We also have state-of-the-art embryology labs. We have on-site surgery centers, and we have locations in Beverly Hills, Pasadena, Santa Barbara, and Ventura. Next slide. With that said, our premier laboratory and surgery center, what sets us apart is our experience and certified directors. We also do double witnessing verifications, embryoscope, blastocyst biopsy with PGTA and PGTM testing. Next slide. So today we will actually be discussing SCRC and your surrogate journey, the medical screening journey, tentative timeline, intended parents journey, and our team. And then at the end, we'll be able to do our Q&A, and you'll be able to ask us questions, and we'll be able to answer those questions. So with SCRC and your surrogate, we actually do a very in-depth process with your surrogate agency and the surrogate themselves. We have Dr. Surrey and the doctors review medical records. We review the profiles to make sure that that specific surrogate is a good surrogate to go through this journey with you. We have surrogates receive world-class support from leading physicians and nurses specializing in third-party reproduction. Next. With medical screening, so before we even go through the medical screening, we make sure that we receive all the records from your surrogacy agency. Dr. Surrey and our doctors will review those medical records to make sure that the surrogate is good for surrogacy journey. With that, the surrogate will come in for her medical screening. She'll go through an HSS, labs, which include STD screening and drug screening. And then the HSS is actually a histosonogram, which they do a checking of any fibroids or polyps to make sure that the embryo implants in the surrogate. Next slide. Medical clearance. So with medical clearance, once we go, the surrogate comes in for her medical screening. It takes about 2 to 3 weeks to medically clear her. Once she is medically cleared, we move into legals, and that's where Lesa comes in. Next slide. So with injectable medications, your surrogate will be taking medications throughout a process of 18 to 23 days before embryo transfer. Dr. Surrey and our doctors will make sure that that surrogate is ready for medications, injectable medications, and will be able to guide her from beginning till the end of the medication she will be taking. With the embryo transfer, Dr. Surrey will then, she will have the day before, she'll have to come in for a ultrasound and blood work to make sure that she's ready for her embryo transfer. Surrogate will undergo the embryo transfer the next day. Once she goes in for her embryo transfer, about 10 to 14 days later, 9 to 14 days later, we will go through an HCG pregnancy test, which is blood work. She will then test for HCG levels so that make sure that we get a positive pregnancy test. Once we get a positive pregnancy test, she goes in for one more after that. And then she will have 3 ultrasounds to make sure, 3 to 5 ultrasounds to make sure that there is a heartbeat and embryo is growing perfectly fine. And after that, your surrogate graduates to her OB. So once about 10 to 11 weeks, she'll be reducing her medications between 6 to 10 weeks. She will start reducing her medications. She will then be graduating to her OB, who will then take care of her for her pregnancy follow-ups. And here is tentatively the timeline from beginning till she graduates from from SCRC's care. Here it is right here, number 1, locating your surrogate, match meeting with your surrogate. I can also be on that call as well with your surrogate agency. That's where we'll have you introduce yourselves, your intended parents, and the surrogate will introduce themselves and make sure that we're all on the same length of vaccinations, parents being there for the delivery, all kinds of things that we go over during that process. And that usually takes about 3 to 6 weeks to match. Once you match with your surrogate, you need to go through financial clearance with our SCRC team. And that usually takes a little bit less than 3 to 6 weeks, but usually we like to say 3 to 6 weeks. We should receive the match sheets after that, number 3, and then your surrogate will be able to go through for her medical screening. Right after a medical screening appointment, it takes about 2 to 3 weeks for medical clearance. Surrogate starts her period. And then she will be put on birth control pills so that we can cycle her, making sure that she does not, she gets her period and make sure that she does not get pregnant throughout the process. Legal clearance takes about 2 to 4 weeks. And that's with the attorneys. And then right after we get legal clearance, we then start a calendar of the surrogate starting her injectable medications. Then the transfer happens, confirmation of pregnancy, and then the OB ultrasound appointments. Then she graduates.
So, welcome to everyone who's listening to us today. I think it will be an informative discussion that will be led by a couple of very well-known experts in this field. Suzanne will be telling us about how she goes about procuring surrogates and where they come from. And I'm going to chat with you a little bit about how we screen them in regard to their medical testing and how appropriate they will be for surrogacy at the time. And Lesa Slaughter will talk to you, I think, about her area, which has to do with protecting you legally from any issues that may involve the birth of your child. And it is your child. So Lesa will discuss that with you. So I wanted to let you all know, first of all, that we've been procuring, screening, evaluating, and treating surrogates for more than 25 years here. And the process technically works very, very well. There are many medical indications for gestational surrogacy that include but are not limited to issues involving the intended parent's ability to carry a pregnancy. Medical perspective, which can involve the reproductive system and uterus. For example, there are people who have had hysterectomies and don't have a uterus anymore. There are people who have had multiple surgeries to try to correct problems with the uterus, which may not lead to the best result. But there are also people who have different medical contraindications to carrying a pregnancy. Pregnancies can be difficult physically on many systems, including the cardiovascular system, your renal system, your immune system. So we like to screen all these things in advance of approving your surrogate by having her have stress cardiograms done with a cardiologist, evaluations of her metabolism, her thyroid, and as well as her uterus, which can be evaluated in different ways by imaging. There are images called hysterosonograms, where we look specifically at the area of the uterus where we would like to see a pregnancy implant. There are other kinds of images, specifically something called an MRI, which stands for magnetic resonance image, that can be very helpful in looking at the muscle around the pregnancy. That's called the myometrium. So there are a lot of tests that we do as a routine. Before we do any tests, we like for your surrogate to be of previous proven fertility. And what we mean by that is she has had an uncomplicated, unremarkable, easy delivery of a baby in the past. And we would like that to be within the previous 6 to 7 years. And so it is true that this usually will portend well for the future, but not always. So we like to start by having the potential surrogates be limited to people who have had pregnancies in the past and have not had any problems from a medical perspective carrying their pregnancies. I'm going to let Suzanne and Lesa perhaps discuss some of the other screening that they may be doing both psychologically and legally with these people, again, with the idea of protecting you and your rights and your baby's rights. So there are a lot of different screening that we do. You know, everybody is a little bit different as to how they think about and want to have their surrogates screened, in so much as that we've had a varied experience with patients, some of whom just want to go to the hospital and pick up their baby when the time comes for a delivery, and others want to be involved with the surrogate, with their pregnancy, with their lifestyles, with how they live, with who they're living with their family unit. So everybody has a different need to satisfy when it comes to the intended parents involved with the surrogate. So what we want to try to do from a medical perspective is eliminate medical contraindications for the surrogate carrying a pregnancy, such as very fragile diabetes mellitus, hypertension, cardiovascular disease, pulmonary disease, things like this that you don't really know about necessarily when you choose a surrogate. It's our responsibility to screen surrogates for their general health, their reproductive health, and their medical health when it comes to carrying a pregnancy. So the center here has been in existence in its present format for over 25 years, during which time we have been providing the IVF laboratory services for many physicians, including the ones at the medical centers locally, which is UCLA and Cedars-Sinai. And the reason for this is that our laboratory here is one of the best laboratories in the world and gives us very consistent, reliable results, which are among the best results that we could hope to achieve. So when Suzanne and her colleagues screen your surrogates, you should be assured that there are no problems with the laboratory once you choose to go down this process. So there are two aspects to this process. The first being the kind of embryo we're going to have, because the embryo itself will serve to screen the surrogate for how appropriate it is to do this process. We not want to have a normal embryo to use for the surrogate. And Suzanne, I think, is going to now tell you a little bit more about how she goes about finding the surrogate. And so, I want you guys to be able to chat with her when we're finished with the presentation here that she's going to be giving you, so that you could have any questions perhaps answered. And we're very happy to see you in person or individually with a remote consultation about your particular needs and issues that we're anxious to hear about. So we'd be very pleased to see any of you, either remotely or in person, to help you answer any questions that you might have. Suzanne, do you want to chat a little bit about how you go about finding the surrogate?
Yes. So here we start off by sending you a list of agencies that you can actually find your own surrogate. It's very normal to experience motions of grief over infertility and loss of ability to conceive on your own. So the process, we're here to guide you from beginning till your surrogate graduates, even till your baby's in your hands. So we actually, as the medical people, we will go through looking for a surrogate, reviewing your surrogate's profiles, making sure that surrogate is a good candidate for surrogacy. We will receive medical records that Dr. Surrey will review, that we will review. But again, you're not alone. We're here every step of the way, providing you with any answers or questions that you may have in regards to the journey. Next slide. So here, like I said, we will send you a list of recommended surrogacy agencies that we vetted. Our selection of agencies that we request surrogate profiles from, we've worked with them for a very long time. Most agencies that we've worked with also send records with previous pregnancies, and so beforehand we'll be able to move forward in even having a Zoom call with that specific surrogate, so that we can make sure that she is medically approved by our doctors.
Okay, hi, it's Lesa. Time for the legal, which I'll make as exciting as humanly possible, okay? So SCRC is going to send you a list of agencies, and that's going to be a list that may be overwhelming because, first of all, very few of us have ever had to pick a surrogacy agency. So the first thing you want to know is, well, what should I look at? especially for same-sex couples and international couples, which I know SCRC works with, is understanding and making sure that the agency can accommodate what you need for ultimately getting your names on the birth certificate. So avail yourself of a free 15-minute consult with an attorney who can really save you some time and some money and some heartache. Part of it is the state. More and more surrogates are located outside of California. Surrogacy is not really like regulated. It's not regulated at all on a federal level, and it is state by state. And some states allow surrogacy just because there's no statute against it. So next slide, please. So think about that as you consider what you're looking for in an agency. You may want a small boutique agency. You may want an agency that's got tons of international or same-sex experience. You may want a medium-sized agency. But I urge you, again, before you sign that agency contract, you can have an attorney specializing in this field, because you want to know, how do they mitigate your risks? What risk can they mitigate, and what risk can they not mitigate? What happens if the surrogate doesn't pass medical clearance? Do you get a refund or not get a refund or get a rematch? So understanding all the mechanics of what that relationship is that you're going to have with that agency. Then it's time, at the same time while you're doing that, it's time to develop your criteria. And Suzanne, jump in if you have any thoughts on that. It's develop your criteria, as Dr. Surrey mentioned, of what kind of relationship you want to have with your surrogate. It's unlike any relationship you've ever had, and you'll certainly won't find any how to communicate with your surrogate books out there, the shelves teeming with them. So think about it. Do you want to just make it a very distant relationship and communicate only regarding medical issues and tests and milestones? Do you want to be there for the birth? Do you want to be able to attend the medical appointments? Do you want to communicate with her weekly? What kind of engagement do you want is one, because the more transparent the communications are, the better the surrogacy journey goes. And that's an area where Suzanne in that matching process will probably be asking you some of these questions, so she can make sure she matches you with agencies and surrogates that are going to meet that criteria. You may want someone local to you if you're in the United States. That may be a different state. What kind of lifestyle restrictions? I've had intended parents say, we only want to eat for her to eat organically. Is the surrogate willing to do that? Usually that's an extra cost borne by the intended parents. And what her stance is on abortion and selective reduction. And even these days, whether or not an abortion is even possible in that state, or will she need to leave and have that done in another state. Next slide. Okay, what to ask a surrogacy agency. I kind of covered this, so I'll just really be brief about it. But part of it is you want a lot of the screening process, all but the medical, to for that's something for the agency to do. So anything basic as, do you do a criminal background check now, or when is that done? What is your matching process, and how long does it take if we need another surrogate or something happens if she doesn't qualify medically? How do they screen and recruit potential surrogates? Good agencies get a lot of inquiries, and very few surrogates make the cut. It's a serious commitment. It's a lot of surrogates, when they get to be and have their profile up, they've gone through a series of meetings, interviews with the agencies. They've helped gather medical records. It is not something where you just pick up one day and say, oh, I think I'll be a surrogate. It's usually a long screening process from an agency, and you want to make sure that you understand that and understand what kind of communication you're going to have with that agency. We picked an agency, as I mentioned before. I'm an intended parent through surrogacy, which is one of the reasons I went into this field and left big corporate law and started my own law firm, because it was overwhelming. There was no dream of having a surrogate carry our babies. You know, there was no Barbie the surrogate doll, right, to learn from. So a lot of this we did through trial and error at the very beginning. But we did have the benefit of consulting with a friend of mine who specialized in this, who was an attorney. So we got a lot of benefits from even just that free consult at the very beginning. Next slide, please. What to ask a potential surrogate. And Suzanne will help you with this because she's done it thousands of times. But these are some things to think about. This is the area where you want to make sure communication and expectations and transparency is the same. That's the best possible way to put the odds in your favor to have a great journey. Part of it is as simple as are you comfortable with us being in the delivery room? Would you be comfortable if the doctor said, would you be willing to have a C-section? How do you handle difficult situations? What would you like to do in terms of conflict resolution if we have one? So it's simple questions too. Hey, how does your husband or your partner feel about you doing this? What are you going to tell your kids? For example, our surrogate, whose name was Angel, believe it or not, she had 3 kids who were very much a part of it and very much wanted to see the babies afterwards. And it was really, really a great moment for not only our surrogate, because she got to show her children what a great thing she had done, but also for those kids to really see, hey, this is the process. Next slide, please.
So with that, matching with your surrogate and getting financially cleared with SCRC, once you found your surrogate and all the boxes have been checked, for example, medical records have been reviewed, in psychological screening, match sheets have been sent over, our SCRC financial team will be in contact with you to discuss this cost associated with your cycle. Next slide. So once we receive the medical match sheets and we'll schedule the medical screening with your agency, in full communication with your agency, getting all the updates in communication with you as the intended parents, the surrogate, and the agency. We don't put all of you guys in one email, but we'll be in contact and making sure my team and myself are in there, making sure that you guys are getting all the updates with your surrogacy journey. We'll handle all the matching process. We'll make sure your surrogate is scheduled for her medical screening at a timely manner, making sure that she's, on her birth control pills, making sure that all her questions are answered when she comes in for her medical screen. Next slide.
Next, your surrogate, you've got your agency, you have your surrogate, she's medically cleared. Now you come to legal. Okay, which I think is the most exciting part, other than the delivery. But seriously, let me tell you just very briefly what the legal part is and what it isn't. What it is it's the contract between you and your surrogate. The agency is not a part of it. It outlines everything the surrogate is supposed to do, and it outlines everything you as intended parents do. It also outlines your risks and liabilities and where that stops, where those risks and liabilities stop, and the same for the surrogate. It is an instruction manual and it is very detailed. It does and addresses everything from worst case scenario to, for example, what happens under termination or selective reduction. What happens if the surrogate is declared brain dead? Does she remain on life support in order to gestate the baby if that's possible? To the delivery room, as I mentioned earlier, or what kind of post-birth contact you will have with your surrogate. It's going to detail all that. So it's a lot of emotion, it's a lot of money, and if a crisis occurs, there should be in that contract a very specific direction on who makes the call and who pays for it.
Lisa, do you want to say how long legal clearance or legal contract?
Oh, yes. Thank you. Okay, so from the moment you hire your attorney and have that retainer, it should take, and a little longer for international parents because of time zone, it typically takes 2.5 to 3 weeks to go from the day you hire your attorney to the day that the contract is signed. And you reminded me, let me get a little more specific. The contracts, for example, in California and most states need to be notarized. Once we receive the notarized signatures, and almost everything these days is done electronically, we write a letter to the doctor, because no doctor wants to put in a foreign tissue into somebody without a letter from an attorney. We write a letter to the doctor and say, the parties have been counseled by their individual attorneys. They understand what they're signing. They've done so voluntarily, and this is my legal clearance to go ahead and start medication. So many clinics, and I don't know about SCRC, but some clinics will absolutely not give you a calendar until they have that legal clearance.
Yes,
So when you want to when you're talking to your attorney, get that timeline. Find out. You don't want to be in legal for 6+ weeks if you don't have to. You want to move it along.
Thank you. Next slide. Oh, some of our promotions are the free image testing with virtual consults. Santa Barbara new patient specials is $375 for consult and ultrasound. So if there's anybody that needs in Santa Barbara, please make sure that you let them know about the special. And here is our team of physicians here at SCRC, along with Dr. Maxwell in Santa Barbara and Ventura, along with Dr. Surrey in Beverly Hills and Santa Barbara, and Dr. Chavkin in Pasadena, and Dr. Danzer and Dr. Alexander in our Beverly Hills office. Do you have any questions at the moment that we can answer, Lisa, and I can answer for you?
Is that going to be on the screen, or is anybody sent in any questions?
Let's see. I don't know if there's any questions that are popping up.
No?
Questions? We are available. Lisa's information was on the very first slide. If there's any questions that you may have for Dr. Surrey or myself, you can definitely reach out to us.
Thanks so much for participating. I hope this was helpful.
Yes. Thank you so much.